name is Anastasia O'Neill, and today I'll be demonstrating the IV med push and piggyback skill. So the first thing I'm going to do is, when I receive the order for the medication, I'm going to check the order that the doctor made against the patient's chart, making sure that it's the right patient, what's ordered is right, it's not going to interact with the fluids I have hanging, and it's not going to have an adverse reaction or anything. So my next step is going to be at the MAR. I'm going to pull up the medications. I'm going to check that they're within date, they're the right medication, the right concentration, and do all of my med math here. These are both correct. I have my piggyback, which is 1 gram of cefotamine, and then my IV Lasix. I've prepared these, that's all good, and I know that while I'm at the MAR, I'm only going to draw up medication for one patient at a time. So now I'm ready to move into the patient's room. I'm going to perform hand hygiene, knock, identify and greet the patient, identify the patient using 2 patient identifiers such as name and birth date. It's correct, and this is where my third check would occur. I'm going to check this against the chart, against the order, and it all lines up. I'm going to assess the patient for any allergies. They reports no allergies. And now I'm going to assess the IV site, making sure it is intact and it's not red, swollen, there's no infiltration, no complaints of burning, itching, or pain from the patient. So I'm going to perform hand hygiene. And while I'm in the patient's room, I'm going to practice GPSP and the 11 rights of med administration. I have my gloves on. I'm going to stop the primary infusion, get a flush ready, and an alcohol prep pad. I'm going to find the needleless port closest to the patient. I'm going to scrub the hub for 60 seconds, allowing it to air dry. I'm going to take the cap off my flush, removing any air from the flush. Going to attach it to the needleless port. Going to hold directly above and slowly flush over like a minute, making sure that it's patent. I'm going to aspirate blood back. There's blood, so it's all good. I'm going to continue flushing. Now that the site has been flushed, I'm going to remove that. I'm going to take a new alcohol prep pad, scrub the hub for 60 seconds, allowing it to air dry. I'm going to take another alcohol prep pad with my medication. I'm going to scrub the hub and allow it to air dry. I'm going to hook this up to the port, holding directly above. I'm going to slowly push the IV Lasix. I know that it has a concentration of 10 milligrams per ml, and he ordered 40 milligrams, so that means I need to push 2 ml per minute. And while I'm pushing this medication, I'm going to assess the IV site and the patient, making sure that nothing's going wrong, there's no infiltration, redness, swelling, burning, pain, anything like that. The patient has no complaints and the site looks great. I've administered that medication. I'm going to take this off, dispose of it. I'm going to grab a new alcohol prep pad, scrub the hub for 60 seconds, allowing it to air dry. Grab a new flush. Going to attach the flush to the port. Slowly flush at the same rate I gave the medication at. This is because if there's any medication in the tubing, I want to make sure that I am not pushing it too fast, and I'm also clearing it out because the IV fluids may be running faster than I had to push the medication. So now that that is all done, I'm going to remove this, grab a new alcohol prep pad, scrub the hub, allow it to air dry, apply a disinfectant cap. I'm going to assess the site, making sure everything's okay, assess the patient's response to the medication. Everything looks good. I'm going to immediately document the medication I just administered. And now I am good to move on to my piggyback skill. So I performed my 2 checks out at the nurse's station, and I'm going to perform my 3rd check here. I'm going to ask for name and date of birth. All right, I'm going to check that against the MAR. It is correct. I'm going to assess for any allergies. The patient has no allergies, so we're all good there. I'm going to perform hand hygiene and get ready to spike my bag. I'll open up my tubing set. And I'm going to make sure that I maintain proper asepsis while spiking the IV fluids. I'm going to push down and twist. I have already clamped the line prior to spiking the bag, to make sure that it wouldn't just fly out. So now that that is all good, I'm good to hang this. I'm going to grab the end of it, fill the chamber halfway full, find the roller clamp, and I'm going to prime this solution slowly to ensure that I don't lose any medication, since it's at a much smaller volume than what the fluids are. If you prime too fast, you could lose a lot of the medication before you're able to stop the roller clamp. So I've done all that. I'm going to take an alcohol prep pad, scrub the end of it for 60 seconds, allow it to air dry, apply a disinfectant cap, hang it up here so it doesn't touch anything it's not supposed to. And now I'm going to go over to my primary fluids. Using the hook provided with the 2nd tubing set, I'm going to hang my fluids at a lower level than my piggyback, and I'm going to take a new alcohol prep pad, finding the needleless port above the roller clamp. I'm going to scrub the hub for 60 seconds, allowing it to air dry. I'm going to grab another alcohol prep pad, grab this, scrub this hub for 60 seconds, allowing it to air dry. I'm going to take these 2, connect them, maintaining asepsis. And now I'm good to start running my piggyback solution at the rate ordered by the doctor, which is 17 drips a minute. I'm going to come back and check at regular intervals, document that I've hung the solution, assess the patient's response. I'm going to perform hand hygiene, and now I've come back, the medication's done running. I'm going to clamp this, grab an alcohol prep pad, disconnect the primary solution from the piggyback, take the alcohol prep pad, scrub this hub for 60 seconds, allowing this to air dry, and then I'm going to apply a disinfectant cap. I'm going to remove my piggyback container, dispose of it per facility policy. And now I'm going to perform hand hygiene, come back, raise this to the height it was prior to the piggyback infusion. I'm going to check the rate it's being administered at and adjust as needed. It's all good, it's at the same rate it was before. So now I can assess the patient's response, assess the IV site, evaluate for any adverse response, clean up my mess I've made, and document and